Good morning, Dr. Eric Klaczynski here, Fanwood Back Relief Center. As a chiropractor, most of my patients come in for either back or neck pain. So today we're going to talk about how, as a chiropractor, I manage the lower back cases that come into the office. Generally speaking, there's three different types of cases that come in. Acute patients, which is a new injury, subacute, which is more recent, and then chronic is something that's been persistent for three months or even longer. And though the management tools for each of these types of scenarios overlaps, there is a specific goal in mind, a specific protocol for treatment for each scenario. So let's talk about each one. Acute lower back pain. So we're talking about a new injury. In this type of phase, when people have acute pain, the primary objective and goal is to decrease inflammation. When you're injured, the first thing that sets in is inflammation, and that can cause pain. It can restrict motion, mobility, sleeping become an issue, walking, sitting, things become uncomfortable. So our primary goal is to reduce the inflammation by a few different means. Number one is we always recommend certain dietary programs that are anti-inflammatory, foods you can eat, supplements you can take that will help to just speed up the process a little bit. Then there's manual therapies. Manipulation is an excellent choice for reducing inflammation fairly quickly. Mobilization, some light stretching. Okay. We refrain from any type of rigorous exercise or even core strengthening at this point. The primary goal is for the patient to move a little bit, rest, and decrease that inflammation and heal. So that's how we handle our acute lower back issues. Now, subacute is similar but a little bit different. In this stage, what we're trying to do is not only decrease some of the inflammation that is there, though there's usually not as much, we're trying to mobilize more, get the patient to move, get the patient to walk, more rigorous stretching, some light exercise, and allow the patient to heal and rehabilitate properly in that subacute phase. The last thing is chronic. Now with chronic, this is a patient that's been suffering with pain, generally speaking, in my office for months or years, and they're looking to avoid future injury. They're looking to keep their spine stabilized and strong. And in this case, we're trying to make sure that their posture's in their best alignment, that there's no restrictions in the joints, and that we're keeping everything flexible and strong. So it's a lot of exercise recommendations at home, specific guidelines as far as what they can do at the gym, and help to assure that flare-ups do not occur. So those are our three phases. Obviously, this is just part of the picture of what we see in our office. Sometimes there's variance, it's never cookie cutter. Each scenario is a little bit different. But if you are suffering with back pain, please shoot us a message, give us a call. If you're looking to avoid back pain, patients always ask me, how can I avoid this in the future, doc? The way to avoid it is to keep your spine strong, keep it flexible, and keep it in the right position. So periodic chiropractic adjustments, being proactive with your health and your care is always gonna benefit you in the long run. That's all we got for today. Hopefully you enjoyed it and have a good day. We'll talk to you next time. Thank you.